Good evening. My name is Goran Yaksic, and today I will be conducting a tutorial on precision and predictive medicine. In particular, we will be looking at the effectiveness of different depression treatments in patients diagnosed with major depressive disorders. We will begin this assignment by creating a pivot table showing the relationship between anxiety diagnosis and response to citalopram, an antidepressant. Next, we will proceed by determining the medication with the highest success rate when the patient has anxiety diagnosis, and we will report the rate of success for each of the medications. And finally, we will determine the medication with the highest success rate when the patient has substance abuse. In this slide, I show you a little glimpse of the data table that you will be using for this assignment. All the ones that you see indicate success. Zeros indicate failure, and no entry means it was not tried on the patient. Now we're going to go to our data table. From here, I will show you how to calculate the relationship between anxiety diagnosis and response to citalopram. Okay, so from here, we're going to want to go to Insert, then we're going to want to hit Pivot Table, hit OK. This is going to take us to a new sheet. From here, we will scroll down to the right, and then all the way down to Generalized Anxiety Diagnosis. So we're going to check this. Then we're going to scroll even more down till we hit CIT Success. Then we're going to drag that down to Columns, and then we're going to drag it again to Values. And notice here how it says Sum. We're going to want to change that. So we're going to go to Value Field Settings, and then we go to Count and hit OK. Now to calculate the probability of success, we're going to want to input the formula getPivotData. Now, it's best if you don't put the formula in, because when you click the cell, it'll just duplicate the formula and thus give you a wrong answer. So it's best just to do equals, and then in this case we're going to click cell C7, which is 117, divided by cell D7, 366, and we're going to hit enter. This gives us our probability of success. Now this number is a bit too big, so we're going to go ahead and reduce it a bit down to 2 decimal points. That should be more than sufficient. And you're pretty much going to repeat this process throughout the remaining antidepressants. As you can see below, I applied the same calculation that I did for CIT to the other 6 antidepressants. Based off the results, we can see that CIT had the highest success rate on patients with anxiety diagnosis, and antidepressants like VEN and MIRT had the lowest. In this next bullet point, I address the question on why I think it is difficult for certain medications to work on patients with generalized anxiety depression. To start off, this could be for a number of different reasons. For one, benzodiazepines, the most common anti-anxiety medication, can worsen cases of pre-existing depression, which may potentially lead to treatment-resistant depression, and may even cause suicidal thoughts and feelings, making it extremely hard for doctors to choose an adequate medication. Now I will show you how to calculate the rate of success of different antidepressants with patients with substance abuse. This is essentially the same process as the one with patients with anxiety diagnosis. The only difference is that for this, we will be searching for drug abuse diagnosis as opposed to generalized anxiety diagnosis. So we're going to repeat the same process as last time. We're going to hit Insert, Pivot Table, then we're going to hit OK. Now, this time we will be looking for drug abuse diagnosis, which is right here, and then we're going to hit check. Then we're going to go down to our first antidepressant, CIT, and then we're going to drag CIT success to columns, then we're going to drag it to values, and then we're going to want to change sum, change it to count, hit OK. And then we're going to want to input our formula, by selecting cell C7 in this case, dividing it by cell D7, and hitting enter. This gives us our success rate for CIT, and we want to change it to 2 decimal points. And you're going to want to do this for the following antidepressants to calculate the success rate. Shown below are the success rates of the different antidepressants on patients with substance abuse. Based off the results, we can see that BUP had the highest success rate on patients with substance abuse. BUP had a success rate of 0.38. In comparison with patients with anxiety diagnosis who had CIT as the antidepressant with the highest success rate, we can see that there is a clear difference. For patients with substance abuse, BUP was the antidepressant with the highest success rate. This concludes the end of this assignment. Thank you.